Today we're talking about chronic kidney disease in cats and how you can actually manage it at home. But before we get into the video, my name is Sam, I'm your cat's nutritionist, and it's important for you to understand that 1, I'm independent, I'm not beholden to anyone, and 2, I only specialize in nutrition, unlike many other people who talk about a myriad of things. Let's dive straight into it. Why does this topic matter? Chronic kidney disease is one of the leading killers of cats. By the time symptoms appear, most cats have already lost a huge chunk of kidney function. They have crossed the Rubicon, as it were. But with management, especially nutrition, we can make a difference between a few months of suffering and years of really good life. So please stay tuned. Now, what is renal failure and why are cats so prone to it? Listen, kidneys filter toxin, regulate fluids, and keep the body in balance. Cats, as obligate carnivores, are very vulnerable. They naturally conserve water but rely on getting most of it from food. A lifetime of dry kibble leaves many chronically dehydrated, and that puts a huge strain on the kidneys. So if you have been kibble feeding your cat for a very long time, there's a very good chance that your cat has been suffering from chronic kidney disease for quite some time. Age, genetics, certain toxins, and dental disease also play a role. And so by around 12 to 15, around a third of cats have chronic kidney disease. Now, I want to draw your attention to protein and protein restriction and why nephrology has changed so much over the years. We now have a lot of meta-analyses, and now we have a lot of randomized controlled trials that have come to a consensus that restricting protein might not be the thing you need to do for your cat. For decades, vets have told owners to restrict protein, and this came from human medicine, from human nephrology about 30 years ago, since amino acids within protein contain nitrogen, and nitrogen waste must be processed by the kidneys. Protein was always assumed to be hard or the boogeyman on failing kidneys, and that led to the rise of renal diets that are often very low in protein but very high in starches, and cats cannot digest starches because they are obligate carnivores. So if you are cutting out protein from your cat's diet and you might already have a renal food, that renal food will be very high in something that your cat simply cannot metabolize into energy because they are a carnivore. But here is where it gets really interesting. We now know that protein restriction isn't protective. In fact, protein may actually protect the kidneys and prolong life. Due to all these new randomized controlled trials and meta-analyses that have formed a consensus, we now know that easily digestible protein is a lot better than restricting protein altogether. What that means is things like chicken or things like white fish tend to be a lot easier to digest than any others. The issue here isn't that cats get too much protein. The issue here is whether the protein is high quality animal protein or cheap plant protein like corn protein meal. Cats are obligate carnivores. They need taurine, they need leucine, amino acids only found in animal protein, not soy fillers. So there is a very good chance that your cat already on some sort of renal food isn't getting everything they need. Why? Because they are getting something that is simply not biologically appropriate and will not do anything for your cat's kidneys. So how does this apply to your cat with chronic kidney disease? The old school advice of low protein diets might not necessarily still be true today. Modern understanding is that cats still need sufficient high quality protein to maintain muscle mass or the avoidance of sarcopenia, which is the loss of muscle, immunity and overall health. More protein means that your cat is going to be much better fed. If you restrict protein too much, that's going to lead to muscle wasting, weakness, and poorer outcomes. The real target here is maybe phosphorus, not protein. Lowering the phosphorus load while keeping protein quality high slows chronic kidney progression. That's why easily digestible protein with certain omega-3 fatty acids like EPA or DHA also reduce kidney inflammation and improves outcomes. Obviously, every cat is going to be different and every cat is going to be at a different stage with their chronic kidney disease. But here are some practical steps for you. First is moisture. Moisture must come first. Wet, raw or gently cooked diets are far better than kibble. If my cat had chronic kidney disease, I would never ever feed him kibble. Absolutely no chance. Those kidneys need to filter water as often as possible. They cannot be dry fed. The second would be protein quality over quantity. Prioritize meat, poultry, fish, and avoid filler heavy renal kibble. And a lot of the renal kibble and a lot of the cat foods on the market also contain sugar. And I don't need to tell you that sugar is not very good for our cats. Number 3, phosphorus control, and that is going to be dependent on your cat's stage. It really does depend. But I want to draw your attention back to hydration. I want you to think of cat fountains, broths, soups, cat soups, or even subcutaneous fluids in later stages. I want you to make fluid the cornerstone of how you tackle this problem, because increasing the amount of moisture in your cat's diet is surely going to lengthen the amount of time they are here with you. There's a couple things that you might to work with your vet with. The one is going to be blood pressure control, because hypertension is common with cats and chronic kidney disease, and anti-nausea and appetite medicines when needed. But this is when needed. Try to not overload your cat with medicines, with treatments, because anything you can do at home naturally, by increasing the quality of your cat's diet, by increasing the amount of moisture that you put through your cat, the better. You cannot just rely on veterinary prescription kibble and more medicines from the vet. That's absolutely not the best course of action. Now, if you are a bit lost, I developed a guide on chronic kidney disease for cats. I highly encourage you to download it if you are a bit lost, because this is such an important aspect in cats and not many people know how to deal with it at home. And this is something that's going to be with you and your cat for a very long time. So if you want to know more, you can download it down below. Remember that protein is not the enemy. The enemy is poor quality, highly processed foods that leaves cats dehydrated, overfed on starch, and undernourished in the amino acids they evolved to thrive on. Your cat does not need less protein. They need the right kind of protein in a moisture-rich, biologically appropriate diet. That's what keeps the kidney supported and their body strong. Chronic kidney disease is very common. With the right nutrition, hydration, and care, you can totally take control over your cat's diet, and you can surely increase the chances of your cat living and staying with you for a lot longer. We help people every single week with chronic kidney disease for cats, and it's not a boogeyman, and it's something quite simple to do. And if you follow step by step what we say in the guide, you have a much higher chance of keeping your cat with you for longer.